Hello, I'm Chris Stout. I'm an endovascular and vascular surgeon with Ozark Regional Vein and Artery Center. We're going to talk about aneurysms today. An aneurysm is where the blood vessel wall gets weakened. So instead of being strong and arterial, it gets weakened, and then all of a sudden it starts to bleb out and it can enlarge. And it's that weakening that results in damage, or it can rupture or clot and cause major problems for patients. When we talk about aneurysms, they can occur in any artery. And one of the most common sites for an aneurysm is in the abdominal aorta. And we call that a AAA or AAA, or abdominal aortic aneurysm. And that aneurysm is in the stomach area, clear back by the spine if you're getting inside of somebody. And the aneurysm usually extends from somewhere in the pelvis up to about your xiphoid, or the bottom of your breastbone. And those aneurysms are the most common. There's actually an act that was passed by Congress a few years back that says if you're 65 that you can get screened for these aneurysms for free if you got a history of family history for them or smoking history, and because there's such a huge number of people that don't even realize they have them. In addition to abdominal aortic aneurysms, there's a couple other big time aneurysms that we worry about, and one of those is in the chest. Those are not going to be an AAA, but a TAA, because it's in the thoracic cavity. So that's what a TAA is. And they're all based on location. A TAA is very similar to an abdominal aortic aneurysm, or an AAA, in the fact that it's basically a weakening of the wall. Sometimes people with really high blood pressure, or, certain people with genetic problems that I've taken care of, Marfan syndrome, other connective tissue disorders, I take care of these patients and watch them very closely because they have a predisposition to developing these really quickly. And if you have a AAA or a TAA, there's a pretty decent chance that you may have a popliteal aneurysm behind your knee. And again, it's one of those things that we're always going to examine you for at Ozark Regional Vein and Artery Center. So it's part of the exam of a comprehensive evaluation of aneurysms. When an aneurysm ruptures or it blows, it's very much like a balloon. You're blowing up a balloon. It's very difficult to get that balloon started to blow up early on. But as that balloon gets bigger, you can blow it up easier and easier until eventually that balloon can't contain any more air and it bursts. And that's what happens with an aneurysm. Once they get to be about 5 centimeters, we want to fix them because 5 is a magic number. Sometimes a little smaller, sometimes a little bigger, depending on other characteristics, but 5 is the way we want to fix them. And we want to get on those. And as a vascular and endovascular surgeon, I have the ability to fix these 2 different ways. Probably the most common way that we fix these now are with stents or stent grafts, another name for endograft, getting back to the whole endovascular surgeon arena. Sometimes we can't fix them with stent grafts, and we have to do the open surgical way, where we actually have to do a big surgery and cut in and fix that artery and replace it with a synthetic tube. But the stents are very, I guess, lower risk. Everything carries a risk that we do, and that's why we wait till certain sizes or aspects. But they're very nice in terms of not having to open somebody up. And I've gone as far as being able to fix nearly every aneurysm without even making an incision in the groin, like most other doctors do. So we can keep these strictly percutaneous. So again, taking that minimally invasive to even more minimally invasive. So if you've been found to have an aneurysm on a screening or incidentally, or any other concern that you have, if you're older and smoked or have a family history of aneurysms, or somebody that died suddenly, then those are the people that we actually need to see and make sure they don't have these aneurysms and get them fixed before they're too late.